Hi, I'm Dr. Annette Zaharoff, and I'm the Medical Director for the Non-Surgical Center of Texas. And I'm here today to talk to you about Platelet Rich Plasma Injections. These are injections that are used for injuries that don't necessarily heal. So our bodies typically, when we get injured, will go through a cycle, a healing cascade to help things get better. They repair itself. But on occasion, our body won't heal, and we need something to help it. And that's where Platelet Rich Plasma Injections come in. These are actually a non-surgical injection of your own blood platelets to help the body heal. So once those are injected, they actually start that repair process. And if you have an injury like shoulder pain, knee pain, hip pain, these platelets will help your body start that repair cycle. So if you have an injury that hasn't healed and you want a safe alternative to take a look at how you can repair and use your body's own natural response, consider platelet-rich plasma injections. So the procedure for doing a platelet-rich plasma injection has several steps. First of all, it's an outpatient procedure, so there's no hospitalizations required. The procedure starts by coming in the office, having a simple blood draw done. And by doing that, you're taking your own blood, avoiding any type of risk of contamination or any type of infection from occurring. So it's a very safe procedure to take your own blood and then take that blood and place it into a centrifuge. And this is a simple process of using a machine that spins, and by spinning will isolate those cells out called the platelets. Once those platelets are isolated, the patient's prepped like they would be for any type of injection procedure. That means sterile equipment is used, the skin is antiseptically prepped, and to be even safer to make sure we target the right area for the injury, we'll use ultrasound, a way to guide the needle to the injection site safely. Once that occurs, the injection is complete, the patient is released home, and they're given instructions for what they need to do afterwards. There are many types of injuries that can respond to platelet-rich plasma injections. For instance, any type of shoulder problem that you've had. Very commonly, tendinitis of the rotator cuff is something that we see very often. Other things like tennis elbow are very common injuries that we see typically that can heal, but when they don't, an injection of platelet-rich plasma has a lot of evidence-based information to demonstrate how they will help that injury repair. Other things may include hip pain or lumbar pain. Low back pain is a very, very common injury that we see that oftentimes needs help in repairing. And then common injuries to the knee. So just about any orthopedic joint in the body can be addressed if those areas aren't healing from an injury by using platelet-rich plasma. I've been using platelet-rich plasma injections in my practice for over 7 years. I've done hundreds, if not thousands, of cases in doing these types of procedures. So I've spent time with different practitioners in different clinics learning these techniques. The other thing is becoming involved in actually teaching these procedures. As part of the Hackett-Hemwell-Patterson Foundation, I'm actually on faculty to help instruct other doctors in regenerative techniques. So if you have an injury to really any joint in the body, an option, if it's not healing, is to undergo platelet-rich plasma injection therapy. It's a very safe and effective way to help the body repair itself.